My name is Geoffrey Kostiner. I'm a urologist with Tidewater Physicians Multi-Specialty Group, the Williamsburg Urology Office. I practice all aspects of urology. Consider myself a general urologist. I specialize in kidney stones, urinary incontinence, prostate cancer, and kidney cancer. Urinary incontinence is defined as the involuntary loss of urine. The biggest thing I think people need to know about urinary incontinence is it's an embarrassing issue, and the only way to get help is to admit you have the problem. The causes of urinary incontinence are threefold. First, you have to think of them as either caused by stress incontinence, which is commonly coughing, sneezing, lifting heavy things type of leakage, or urge incontinence, where you have the sudden, strong urge to go to the bathroom and you just can't make it, and then you completely wet yourself. And then there's a combination of two of them called mixed incontinence. The diagnosis of urinary incontinence is primarily a clinical diagnosis. Usually the patient comes in and complains that I have wetting problems. The diagnosis of the type of incontinence, that's sometimes a little bit more challenging because your body doesn't always tell you the truth about what the cause is. So in those cases, we have to rule out an infection. We do a urinalysis to rule that out. We have to evaluate the bladder emptying function, and if we have more complex issues or we need to do surgery in order to help the patient, then we have to analyze their bladder filling and emptying function with a complex test called a urodynamics study. The treatment options always come down to the type of incontinence. So stress incontinence is generally treated with fixing the anatomy. There are sling procedures where we actually just create a little blockage so that when there's the activity that causes the incontinence, it's blocked. For urge incontinence, there's a huge pharmaceutical market for overactive bladder symptoms where there's the urgency that makes you wet. There's also minimally invasive options, one being an interstim procedure, and it has probably the highest success rate of all the treatment options I've talked about, but again is not always first line because it's a little more invasive. There are many people out there who live with incontinence who don't bring it up to their doctor because it's embarrassing, and there are treatments out there, and people need to know that they don't need to live with this big issue actually that can really prevent you from enjoying your life and detract from your quality of life.